It is a pleasure and a delight and an extraordinary honor to be here to talk to you today. And I want to talk about Rotary first because in the halls of global health, Rotary is considered a hallowed term. It has such reverence attached to it because of what Rotarians have done alone and collectively. And collectively, this just shows what you have helped to do. I take that back. What we now, thank you, Canon, what we have done collectively is to decrease the number of cases of polio. Look at that high point there and to that low point. We have reduced it so it is 0.1% of what it was. That is an extraordinary, extraordinary achievement for global health. And so, yes, we talk about Rotary, and it has special reverence attached to it when you talk about Rotary. I would also say that maybe it was even harder to get Rotary to be respected that much at home. But there was an article Saturday in the New York Times, I don't know if some of you saw it, but it talked about what people are doing now when they retire. They're not just retiring and staying home, but they're retiring, and it said they're doing one of two things, basically. They're joining the Peace Corps, or they are working for Rotary. And my wife read this article Saturday morning, and she came in to me and she said, now I understand when you talk about Rotary. She said, wow. So to get my wife to say wow is no easy feat. To reduce polio to this level is almost impossible, but Rotary is very, very special. So for me, this is an incredible honor to be here and talk to you. I want to talk a little bit about smallpox because it's the only human disease that has ever been eradicated. It became potentially eradicable almost 200 years ago when Edward Jenner invented vaccination with cowpox to keep people from getting and dying from smallpox. Thomas Jefferson heard about this and he called Jenner. He wrote to Jenner. He couldn't call Jenner. He wrote to him and he said, this is extraordinary. He said, in just a couple of years, there won't be any more smallpox and people will just remember it as a historical fact. Well, it took a little longer, but it was a man named Bill Foege, someone from Atlanta here, who was sent to India in 1973 and had them change the paradigm. They'd been trying to get rid of smallpox by immunizing everybody and hoping that there'd be no more susceptibles. And once there were no more susceptibles, the disease would die out. But they couldn't reach everybody. There were so many children born in such remote places, they couldn't get to them, and the strategy wasn't working. And Bill Foege said, let's change the approach. Let's just go to those villages where they have active cases and immunize everyone there. And don't let anyone from those villages leave until 30 days. And either they're immune because they've been vaccinated, or they got it and recovered, or they got it and they died. We'll just contain all those villages where they have it. They had about 125,000 cases, so this was no small task. But Bill Foege changed the paradigm, he changed the strategy, and he made possible probably the most spectacular achievement of global health ever, to eradicate a disease from the face of the earth. He did that with smallpox, and he'd be the last person to tell you that he was responsible. He'd be the last person to tell you he played any role in it, but he did. And I went to him and I said, what were the three most important lessons you learned from your experience with smallpox? And he said, first, I learned this is a cause and effect world. Things happen for reasons, and if we can understand the causes, we can change the consequences. We can intervene. We can use science to understand problems and change the outcomes. This gives us incredible power to intervene in the world and make it a better place. He says that's the first thing. We can change things if we understand the causes. He said, second, know the truth. He said, for smallpox, we had to know where the cases were, and that meant When we got there, they told us there were 87,000 cases, but we had to search to make sure we had all of them. He said, we found there were 125,000. And when we reported that, the Minister of Health came and said, you've got to stop this, Dr. Foege. You can't use this containment approach. And Bill Foege was very nervous because they were on the verge of turning it around. And he knew that they first had to search, and they found more cases. When they thought there were 87,000, it's just because they were missing a lot. The Minister of Health said, I'm going to stop you. You can't do this anymore. He said, when you came, there were 87,000. Now there's 125,000. Obviously, you are making it worse. Until a young man stood up and said, Mr. Minister, I'm just a poor young boy from a rural village, but I can tell you in my village, when there's a house on fire, we pour water on the house on fire, not on every house in the village. And that's what the containment strategy is. The minister said, now I get it. I'll give you one more month to turn things around. In that month, they did turn the numbers around. That led to this most extraordinary feat. Know the truth, even if it may potentially hurt your cause. And third, he said, coalitions are essential. He said, we never could have done what we did in India without 250,000 people working with us. We had to have people guarding each village that was infected, not letting people out. We needed vaccinators. We needed people to bring food into the village. We needed people to go track down people who had been exposed and bring them back. 250,000 people participated. He said, there is no way we can tackle these large-scale global health problems with just one agency, let alone one person. He said, coalitions are really critical for any major success we hope to have. When Bill Foege came back, he was made director of CDC. He was there for 7 years, but then left because he thought it was too bureaucratic and political. And he searched around for things to do, and he saw that in the world, in the US, in Europe, in Scandinavia, almost all children were vaccinated, immunized against the common diseases of childhood. But in poor countries, only 20% were immunized. And he did a quick back-of-the-envelope calculation, and he said, we could save the lives of 3,000 children every single day if we could get the levels in the developing world up to 80%. And he said, why can't we do it? He went to the organizations that were doing it. They were basically the World Health Organization and UNICEF. And he said, why can't we raise the levels to 80% even in the developing countries? And they said to him, you just don't understand. They said, we've been doing this for a long time. We know the countries, we know the process, we know the donors. It doesn't get any better than this. And he stepped back and he said, these two big organizations, instead of working together, are competing. They're competing for countries, they're competing for donors, and most of all, they're competing for credit. And he went back to them and he said, what if we work together? He said, I bet if we put together a coalition, we could raise the levels to 80%, even in the developing world. And they told him he was out of his mind. But he's a really good salesman, and he convinced them to try it. So he built this coalition that you see here in the picture. He got the World Health Organization together with UNICEF, together with the World Bank and the Rockefeller Foundation and UNDP. These 5 organizations formed the Task Force for Child Survival. This was now 30 years ago. And in the first year, they didn't raise the $35 million that these organizations had been doing. They raised $100 million. The second year, they raised $200 million. And by 6 years, the immunization levels in the developing countries were at 80%. It was an extraordinary success. And it really convinced Bill Foege that coalitions were the way to go. You had to form partnerships. 3 years later, the CEO of Merck, Roy Vagelos, came to Bill Foege, and he said, we have this drug called Mectizan. If you have dogs, you may give it to your dogs as HeartGuard. It's a deworming medicine. He said, we found out that the same medicine we sell for veterinary purposes, for deworming dogs, cattle, horses, sheep, that it also works to prevent river blindness, a horrendous inflammatory disease spread by the bite of a black fly in West Africa. It blinds millions of people. Tens of millions of people are at risk. He said, we will give this drug to you for free, as much as you need for as long as you need it, till you get rid of river blindness in Africa. And Bill Foege thought it was a great idea. He went to his staff and he said, look, we have this fantastic offer. Should we take it? And his staff all said the same thing to a person. Absolutely not. He said, not? Why not? They said, oh, you don't get it, do you? We work in public health. We're good. We don't work for profit. Big pharma, that's a business. They're bad. They do bad things. They gouge prices. They make a profit. They sell to people at high prices. We don't want anything to do with them. They are the devil incarnate. Stay away. So Bill Foege went back to Roy Vagelos. Roy Vagelos said, well, will you do it? And Bill Foege said, yes. He saw the good that could come of it, and he said yes. And he said there's much more altruism in the private sector than we would ever think. And there are, hard to believe, self-serving people in the public health sector, more than we like to think. But he brought them together, he bridged it, and today we've now distributed more than 1 billion treatments for river blindness, and it looks like this disease, this horrendous disease, can actually be eliminated. A spectacular achievement that came from a vision and collaboration. The International Trachoma Initiative works to distribute Zithromax. You may have taken this in the form of a Z-Pak. It's a very common form of a long-acting tetracycline antibiotic. And what has been found is that if you treat an individual whose eyes are infected with chlamydia, in this country we think about chlamydia being affected with a sexually transmitted disease that causes a lot of infertility and pain, but in places where they don't have water to wash their faces, young children get all sorts of secretions on their face, from their eyes, from their nose, from the food they eat, and flies land on their face. And these flies transmit chlamydia. They infect their eyes. They get into their eyes chronically, and they cause scarring of the eyelids. And your eyelashes, instead of protecting you, turn in and scratch your cornea. If you have ever had a piece of dust get in your eye, if you're a contact lens wearer, you know the pain that we talk about. When you get dust in your eye, you've got to stop. Well, these people's eyelashes turn in every time they blink. It's like scratching your cornea with thorns. It turns out if you treat those children with Zithromax, you can eradicate the chlamydia infection in that child. You can prevent this damaging form of blindness, the most widespread infectious source of blindness in the world. If you treat the whole family, you can eliminate it from the family. If you treat the whole village, you can eliminate it from the village. If you treat the whole region, you can eliminate it from the region, the whole country. Now you get it. And our hope is we can treat the whole world wherever they have this. And ITI, the International Trachoma Initiative, is working to get rid of blinding trachoma by 2020, and we're on track. This photograph is of 4 people waiting outside a clinic in Ethiopia, Bahir Dar, waiting to be seen. They aren't the beneficiaries of early treatment. They've all lost part or all of their sight. But this is something that doesn't have to happen anymore. This is a drug donated to us by Pfizer, and we distribute it. Again, another coalition. The World Health Organization in 2000 had as a policy that if someone gets infected with multiply drug-resistant TB, it would be too expensive to treat them if they lived in a poor country and if they were poor. Because there had been an outbreak of multiply drug-resistant TB, Jim Kim called this Ebola with wings because it spreads easily. There had been an outbreak in New York City, and they had to hospitalize the people with MDR-TB, and it cost $200,000 per case to treat and cure it. And the World Health Organization said that's too much money to spend on one person in a poor country. And their policy was if a person in a poor country gets MDR-TB, you just have to let them die. This is a picture of Joel, 4 siblings in his family, and he's holding their pictures. 4 siblings contracted MDR-TB and died. Joel contracted MDR-TB, but he was under our treatment program. We said we could do this for much less, and we showed that we could treat Joel and others not for $200,000 a case, but less than $2,000 a case, that it was feasible. And as a result of that coalition and that demonstration, the World Health Organization changed their policy to say wherever someone gets MDR-TB, whatever kind of TB it is, that person needs to be treated. So a coalition changed the world for Joel and his mother, who also got sick and got better, and for tens of thousands or millions of people around the world. My final example stems from an incident I had here when I was going to work out. I do like to swim. I was going to swim early in the morning, and I thought I saw a body in the road, and I pulled over. This was just 2 blocks from my house. It was still early morning and dark. I wasn't sure what it was. I pulled over, I called 911, and ran over. It was a young woman who had just been hit by a car. She just had on running shoes, shorts, and a T-shirt, but she had a horrendous head injury. She'd been hit, thrown through the air, and landed on the street. And I started doing CPR. Pretty soon the ambulance did come, and a woman got out and said, "What do you want to do?" And I said, "What do I want to do? I'm just so glad you're here. Pick her up, take her in." They said, "No, think about that. It's your call. You're the first doctor on the scene, and it's your call." And I said, "Take her in." She said, "Are you sure?" I said, "You're never sure. We don't know what's going to happen, but intubate her, pick her up." This woman was arguing with me. She said, "Do you see how serious this is?" She said, "Those are her brains on the street. If you take her in, you're not going to do her any favor or her family any favor. Are you sure?" All this time I was doing CPR, and she bled out and she died in my hands. She was a vulnerable pedestrian. She didn't have a chance when she was hit by a car. And this happens around the world millions of times, millions of times. There's an epidemic of people being killed on the roads and on the highways, especially in developing countries. More than 1.5 million people will be killed this year. Most of them are like this young runner, vulnerable pedestrians. No one was paying attention to this. We formed a coalition, brought this to the United Nations, and people said, "You'll never get this on the agenda of the General Assembly. Traffic injuries? No way. We can't even get AIDS on their agenda." We did. We formed a coalition. We got a special General Assembly session, and now the UN is committed to working on what they call a decade of global road safety to prevent these around the world. It's extraordinary what you can do in a coalition, but it's not easy. It's not easy to form a coalition, and I always say a coalition is like a marriage. It's very easy to get into it, but very hard to make it work. And I used to ask, is there anyone who disagrees with that? And like an idiot, I would get involved in arguing with people, because inevitably someone would raise their hand and say, "I'm married. I married my high school sweetheart. We always get along. We've never fought for a day in our life. It's very easy. I disagree." And it took me years of engaging in these arguments to realize that there's certain people who just don't tell the truth. You are not going to convince me that there's any marriage or partnership that's easy. I just don't believe it. It's so different from my experience. I used to get involved in these discussions. I'd like to talk about Yogi Berra, who is from my hometown, Montclair, New Jersey, and he got an honorary degree. And when he got this degree, Yogi Berra said, in theory, theory and practice are the same. In practice, they're not. In theory, theory and practice are the same, but in practice, they're not. In theory, building coalitions and collaborating is easy. We all think we're experts at it, but it is not easy. It's hard. And I'd like to talk about this quote from a French psychoanalyst named Lacan, and he said, "Love is giving something you don't have to someone who doesn't want it." It's a puzzle at first. Love is giving something you don't have. Well, what it is that you're giving is the search for perfection. We all want to fall in love with a perfect mate because that mate will make us perfectly happy. In fact, she or he will live just to make us perfectly happy. So we want to find the perfect mate. We're not perfect, but Lacan says we don't have perfection, and we're looking for someone who is, but the people we're looking for don't want our imperfect selves. They also want perfection to someone who doesn't want it. They don't want an imperfect person. So love is something that we idealize, that we're going to find perfect spouses, perfect partners, or perfect partners in our coalition. But that's not what we're like. That's not what our partners are like. And it's hard to work to make these partnerships work. But the best partnerships bring together people like in a marriage, people who are complementary. So there are ways in which my wife and I are complementary. I save things. My wife throws them out. She says, I save everything. I say she throws out important things. She says, if it were just me alone, I would die like one of these hoarders in a house where there was no room because I put things all over. I make piles. But we work this out. Our house is quite livable, it's quite presentable, and there are other ways we're complementary, but the best marriages are complementary. That means when you discuss your kid's school, you play out both sides of the argument, and your kids benefit. So there's some value for survival in this, and some benefit we give our kids by picking a complementary partner to be our spouse. But what it means in a marriage is that you will argue more. You will fight more. And what it means in a coalition or in a partnership is that you do disagree. You have to work things out. That's what we try to do at the task force. We try to bring people together to work through these things so we can achieve the types of goals that are only achievable with a coalition. Today, the task force works in 87 different countries. You heard we're based in Decatur. We have about 104 employees. We have offices in 4 countries. We work in 3 areas on vaccine preventable diseases. We're doing a lot of work on polio. We're doing work with Rotary clubs now on cholera. We work on health system strengthening. We are lucky to be a trusted steward of resources. We can be more nimble than government organizations. We can transfer money to a foreign country in a day that might take a big organization a year. I like to think we're efficient. We use a very small part of our income and revenue to support fundraising and general administrative costs. The typical charity in the US spends about 25% of their budget. Of our revenue, we spend about 0.003%. And the Better Business Bureau is willing to approve organizations and charities that spend less than 10%, and they say that spend at least 65% of their revenue on their programs. We spend 99.8% of our revenue on our programs. We like to think that we add value to Metro Atlanta. We work with a lot of other organizations here, with CARE, the Carter Center, CDC, Morehouse School of Medicine, Emory University, the CDC Foundation, and Rotary. We bring people together. We help them convene. We like to think we add some value to the coalitions. And we frequently bring global partners to Atlanta. We bring the World Health Organization. We bring the World Bank to Atlanta. Pfizer, Merck, Johnson & Johnson, GSK are very important partners. We no longer think that they're the devil incarnate. In fact, these partnerships, public and private, are some of the most important ones that we do. Also, being in Atlanta has turned out to be an extraordinary benefit to us. We have really been blessed in being the beneficiaries of wisdom of some people that this city has to offer. In this room, I know there are extraordinary people. Someone who's been very important personally to me, and I've had wonderful mentors, but someone who has helped the task force from the very foundation of it has been Jim Laney. And I think I have benefited incredibly from my association with him. And I think this room is full of people who are extraordinary mentors, who have extraordinary wisdom to pass on. But I am really grateful. We are tremendously grateful. There's growing demand for what the task force does. If you look at our revenue has gone up. It's now over $51 million. We started out very small at less than 10 million, 6.4 million. About 1/3 of our revenue comes from government contracts, about 1/3 comes from foundations, and 1/3 comes from the private sector, from corporations. But we've benefited because there's a need to bring people together to work together. And we've also been trusted to be stewards of resources that can make an incredible difference around the world. And this shows you the growth in our charitable contributions. Most of these are contributions in kind. We get the Mectizan from Merck, we get Zithromax from Pfizer, and they trust us with extraordinary levels of these resources. It's not that we're rich, but I think we're trusted to do a good job, and we are very grateful for that chance to have an impact around the world. As a result, as you heard Cannon say, the task force is now listed as the 4th largest charity in the United States because the amount of contributions that we receive, and the largest nonprofit in Georgia. This has not been our intention, this is not one of our goals, but it does put us at a level where we can start to make a case for the good that can be done. I want to close by saying, and giving a quote from Bill Foege, I titled this talk, Building a Cathedral for Global Health. And I would say that trying to work with the health of the world's most vulnerable and most neglected populations is a privilege and an honor for us. Getting them up to par, getting equity is not going to happen in a day. It's not going to happen in a year. And Bill Foege likened this to building a cathedral. He said a cathedral is something that people commit to work on, even though they know it may take 300 years, even though it won't be completed in their lifetime. They engage in that. I show this picture. This is of La Sagrada Familia, a cathedral in Barcelona that was designed by an extraordinary architect, Gaudi, and it was started in 1882. When we went to visit it, you can see the cranes on top, even with modern-day construction. Tommy, I don't know how much faster they'd finish if you could help them. But even with modern-day construction, this is taking more than 150 years. It's going to take a very, very long time, but we're in this for the very, very long run. Bill Foege talked about this is the work of the task force, and he said the task force is like the mortar that holds these bricks together. It's an extraordinary chance to serve people, to put service beyond self, and it's a great pleasure to be here and talk to you. Thanks.